How you doing, guys? This is a short video on dealing with cases with an angry patient, a frustrated patient, or a demanding patient. Now, these are challenging situations, not because we often don't know how to deal with the medicine or because you don't know what to do from a clinical point of view, but it's just dealing with that patient who's on at you for 10 minutes, non-stop, relentless, putting you under pressure. And that's the bit that we find a little bit challenging. So on our courses and mocks, we do a lot of angry patients, but people are often asking us, what are the key things that you should do? How do you make it a little bit simpler? And let's be honest, when you practice these types of cases in your study groups, it's always a bit nicey-nicey. You'd find it very difficult to put people under real pressure, and that's why it's important to practice these things and have a key set of ideas and tips under your belt for when they come and hit you. So let's get started. So the first thing that's really important to get right when you get a patient who's angry in the exam or a little bit frustrated is to get that first impression right. Now we've talked about this on our first minute video, but it can't be more important than an angry patient. There's a couple of things you can do to get this first impression right, which will allow the case to hopefully progress a little bit smoother. The first thing we talk about a lot is distance. Often we're seeing upset patients, for example, or embarrassed patients, and we're often trying to get a little bit closer to the patient to get their eye lines, try and build that rapport. Now, sometimes the opposite can benefit you when it's an angry patient or a frustrated patient. Now, think about this. If you're confronted with an angry person and you pull your chair up and you sit close to them and start mirroring their moves, you're probably playing into the role player's hand actually, because it's much easier to make someone feel under pressure when you're much closer to them. So actually, sometimes sitting back a little bit, adjusting your chair, shuffling back a little bit can give you that breathing space, which makes you feel a little bit more comfortable, a little more confident in the way that you're dealing with things, and actually makes the role player probably have to work a little bit harder to put you under that same amount of pressure. So the first thing is distance. Get a little bit of distance between you and things should settle down a little bit. Secondly, we talk a lot about eye level. Now, if you're sitting down and you have someone who's standing up and sort of shouting all over you, it's very difficult to get that rapport because straight away the person who's doing this to you feels a little bit more in control and you feel a little bit out of control, and that can make you do things that you don't want to do or had no plan or intention of doing in the first place. So if the person stands up, make sure you're standing up at the same time. Get that little bit of rapport built, and then perhaps say, how about we take a seat? I can see you're upset here, but look, let's see what we can do, or let's see if we can sort this out for you. But don't start on different eye levels because it makes things a little bit more difficult. It takes longer to get the anger dissipated. And thirdly, it's about your voice. Now, when someone comes and shouts to you and demands things of you, it's really easy for our emotions to take care, and our voice can suddenly get higher as well. And all that happens then ultimately is an argument. Nothing really gets achieved. So it's about keeping your voice calm, just remembering, you know what, they're just acting here, they're just doing this to put me off. I've got to remain calm, my voice has got to remain stable, and eventually they'll probably need to come down, they'll have to come down and meet yours. Whereas if you're rising to meet them, then you're going to struggle because you're always catching and then going further and further away. So get your voice calm, keep it nice, even pitch, and it should help to get things moving pretty quickly. Second most important thing to think about is not to jump in at every single line that they say and cut them off each and every time. Now remember, listening is really important when it comes to an angry patient. They've got stuff on their chest. A frustrated patient, they've got things that are on their mind, and in the exam they're going to say these things whether you like it or not. So you might as well let them do it. A little bit of active listening, just some nodding, just showing intent is really important. And remember, you're remembering the things that they're saying, but you're not jumping at each and every line because that's very difficult to calm down. So listen intently, give them some time, allow them to get everything off their chest because eventually it all has to calm down. And then after that, you need to start reflecting some of those things back. So because you mentioned this earlier, and I can see you've been through a difficult time. Mrs. X, I can see you're really frustrated by everything that's going on here, and I'm really glad you've come to see me. So it's about listening, drawing some cues in, and then reflecting them back once that initial period of sort of frustration has happened. And this is where things like apologies can come in. Now remember, apologies sometimes are an important part of dealing with angry, frustrated, demanding patients, but it's important that you know what you're apologizing about. Gosh, I'm really sorry that you had to go through all of this. It sounds like you've been through a terrible time. I'm really sorry that it's got to this stage that you've had to come in and chat with us about this like this. So apologizing is fine, but make sure you know what you're apologizing to, because you may not have all the facts yet, so you might not be able to apologize about specific things at this point. It's a lot about empathy. You know, sometimes we think angry patients, how are we going to empathize with them? But remember, anger stems usually from other emotions. Someone's been distressed by something, someone's been upset by something, someone's been quite sad by something that's been happened. And actually, anger could just be a manifestation, or at least an initial manifestation of this. So sometimes empathy is really important in people who are demanding and frustrating. They may have fears that need to be empathized about, and that's why they're so demanding for a scan or something like that. So listening is really important. Reflecting things back is really important. Apologizing when it's needed is important, and also empathizing with the situation they've had to go through are key things really to get things on your side and to allow you to take the data gathering further once that initial burst has happened. So a third thing to think about when you get a patient who in this exam is quite angry or frustrated or demanding is that you've got to show your confidence at some point as well. Because remember, until you show your confidence, sometimes the patient is going to, in this exam, is going to keep on pushing at you and keep on looking for that signal from you that you're going to take over and do bits that you need to do here. So yes, you're going to feel under pressure. They're designed to put you under pressure, but they're looking to see, do you do things differently because someone is putting you under this pressure? Do you perhaps treat this patient differently to a different patient that will come with exactly the same scenario set of symptoms, but is just nice to you? Does it ultimately change your plan? Do you do things that actually you know are not right, but you're kind of being forced into doing? So showing confidence is really, really important in demonstrating that you're able to tackle this type of scenario in real life, but also demonstrate to the patient that you also have some element of control here and that you're going to be looking at what you can do from your point of view as well as theirs. So, for example, you might get a patient come in demanding an X-ray, for example, and you want to do certain questions about clinical questions that allow you to decide whether an X-ray actually is valid or not. Say they want an X-ray of their stomach. So you're going to want to ask a lot of these questions: any pain in the tummy, or are you feeling sick? Any problems with your bowels? Ask for any radiation of pain, for example. And every time you try a question, there may be some quite sharp answers. Oh, doctor, nothing's wrong with me. I haven't got any pain. I don't have vomiting. I told you everything else is fine. Why are you asking me all these things? Now, it's quite difficult to take that, but there's two approaches. Some people will stop their questions because they don't want the patient to get angrier because the patient clearly is getting irritated by this. You've picked up on a cue and you don't go down there. Now, the trouble with that approach is how do you then adequately manage the patient from a clinical point of view? You may be able to manage their anger, but you haven't actually been able to manage the problem yet. So you'll come to the second half and struggle anyway. Or you take the approach where you acknowledge the frustration, but you show your confidence in the fact that you also have some things that you need to do. Yeah, Mrs. X, I can see you're getting really frustrated by all these questions I'm asking you about your stomach. Look, I'm really sorry. I suppose when someone comes in asking for a tummy x-ray, there are just certain questions that we need to ask first, just try and figure out if it's the right thing for you. Perhaps there's things that are better. And Ms. Smith, I can see you're really annoyed by these questions I'm throwing at you, but I promise you these are all routine questions that we tend to ask when it comes to tummy pain, and I promise it's not going to take too much longer. So by saying phrases like that, you're not only acknowledging the patient's anger or frustration or demand here, you're not just forgetting that that's there, but you're also showing that you have control. You have an element of control here, and you realize that you still need to get certain parts of data gathering before you can manage this patient. If you leave data gathering having only dealt with anger and not got your data, then you're going to struggle to manage, remember. So it's all about showing confidence from time to time, acknowledging their emotions, but showing that you've got a job that you need to do and getting that done effectively as well. The fourth thing I want to talk about, guys, is your basics. Don't forget your basics. Now, when you've seen lots of our videos, I always talk about your basics, getting your fundamentals right. If you don't get your fundamentals right in data gathering, your management is you're going to struggle. So yes, a patient's angry. Yes, a patient is frustrated. Yes, they have complaints possibly they want to talk about. They want demands for x-rays, referrals, that kind of thing. But remember, your basics are going to get you the data. It's not just about dealing with that frustration. Things like ICE, things like psychosocial, really important. If you don't get these things out and you just focus on the medicine and dealing with the anger or just dealing with the anger itself, then your management is going to be incomplete. So ICE, for example, remember from our ICE video, ICE is about finding out what's in the patient's mind. Now you can see the surface, you can see what today's situation is in the patient's mind, but actually what are the underlying things? What are the reasons that perhaps have got them to this stage of anger and frustration in the first place? Are they worried about an underlying cancer and that's why they're so pushy and that's why they're so demanding for what we think is an unreasonable CT scan request? Have they got issues going on in their mind, which is why they've led to complaining about a certain situation? Maybe beliefs about what something that should have been done earlier, a misunderstanding from the past, and that's why they've come in complaining and wanting to show their frustration. So finding out ICE, for example, is crucial in order to get out what's going on here so that you can help to manage the situation effectively. Things like psychosocial, you may think, oh, why ask about psychosocial? This is a patient who's angry. I need to sort this anger out. I need to deal with all of this. Yes, but it could be something in their life that's led to this situation in the first place. So, for example, there could be problems at work that have led to this frustration. There could be problems going on at home that have led to this frustration and anger. Or there could be implications on their home or on their work because of this anger. So, if someone has problems with anger control or anger management, for example, it could be that they're afraid of losing their job because their boss has picked up on it. It could be that the constant anger, the constant frustration, the irritability of whatever's causing it is actually causing a huge impact on this patient's relationship at home. So finding out basics like your psychosocial and your ICE is fundamental to any case, whatever the emotion, anger, fear, being upset, scared, frightened, whatever it is. And like I said, anger is no exception. So yes, you're focusing on the anger and dealing with that. Yes, you're focusing on your medicine and making sure that's tight, but don't forget your other basics, things like your PSY, things like your ICE. And for more info on those, you can always check those videos out earlier. So guys, I hope that's been of value to you. I hope it's given you a couple of ideas for which to take forward into your preparation and practice. There's loads written about how to deal with angry patient scenarios in exams, how to deal with demanding, frustrated patient scenarios. So I'm sure you're going to pick up lots of other stuff and blend it all in and work out a way that works well for you. But they are going to challenge you, these situations. They're designed to put you under pressure, but it doesn't mean that you have to struggle with them, and there is ways of dealing with them. Now, if you have any other videos that you want me to make in terms of the CSA or the AKT or anything to do with GP training, then drop me an email or drop me a tweet. This is how this video came about. If I do meet some of you guys on our courses, great. I look forward to seeing you then. But if I don't get to meet you guys and you're doing the exam in the near future, all the best. I'm sure it'll be great. And hopefully I'll see you guys soon.